Hello everyone, my name is Lojajun.
My name is Anissa Yasmin binti Ahmad Nazrin.
Hi, I am Hazlin Shaira binti Sulaiman.
My name is Movindra Analaki Chandrasekharan.
My name is Jacob David Dionga.
And we will be talking about eating disorders among teenagers and young adults in UTP.
In today's society, eating disorders have become an epidemic, especially among teenagers and young adults. Eating disorders are behavioral conditions characterized by severe and persistent disturbance in eating behaviors, as well as associated distressing thoughts and emotions. According to recent studies, eating disorders are becoming more prevalent in Malaysia, particularly among university students and adolescents. For example, one study found that around 14% of Malaysian university students develop an eating disorder. This study explores the various types of eating disorders that are commonly found in this age group, particularly among students of UTP.
The increase in prevalence of eating disorder has become a growing concern in Malaysia. In order to create a successful intervention program, we need to comprehend the risk factors and underlying causes of these disorders.
There are many significant reasons as to why we want to study this topic particularly.
The first reason is to increase awareness about eating disorders amongst young adults, and the second is to explore preventative methods in order to counteract eating disorders from occurring in universities.
To enlighten the student regarding to eating disorder and investigate the factors to contributing to the development of eating disorder related to UTP students, to explore the preventions, strategies, and initiatives needed in reducing the incidence of eating disorder in young, adult, and teenage among UTP students.
What is eating disorder? Eating disorder are a mental health problems that connected with our emotion, physical, and social implications. One type of eating disorder is bulimia nervosa. It is characterized by binge eating episodes that are followed by compensatory behaviors. Second type would be anorexia nervosa. The victim reduced their food intake and being a malnutrition by Kugu et al. 2006. Next type would be binge eating disorder. The victim consumed a lot of food in a very short period of time because of lost control. In university student scope, the female have higher percentage of eating disorder than male. In the between of age 18 to 25 years old, it is the critical moment that can establish eating disorder by Tavolaki et al. 2015. Academic pressure, competition, and the pursuit of perfection can all contribute to a highly stressful environment, which can lead to disordered eating habits as a coping mechanism. Significant life-changing transition occur when young adults graduate from secondary school and begin university life by Chin et al. 2020.
University students face stress and challenges when transitioning to campus life. The pressure to maintain grades and study for tests can result in heightened stress levels, possibly leading to emotional eating, obesity, and thus eating disorders. After that, the influence of peers and the media can affect the risk of eating disorders among students. Nowadays, the media often presents unrealistic body standards, causing individuals to perceive them as the norm and compare their bodies with overly high expectations. Our study also found that women have higher risk of developing eating disorders due to society's higher emphasis on women's body sizes and shapes. Thus, women will criticize their own bodies more to meet those standards, resulting in lower body satisfaction. Lastly, individuals with eating disorder often have pre-existing conditions, such as depression.
According to Manaf, eating disorders cause more death compared to other mental disorders. Patients tend to be overweight or are perceived as overweight. Empirical studies show that overweight children are likely to be rejected by their peers. According to a study of 50 overweight adolescent females, the girls detailed experiences with name-calling and teasing. A student's low academic performances could also be influenced by eating disorders. Students tend to skip classes and miss out on important information. Additionally, vitamin shortages impair a student's focus and memory, which can negatively impact their final grades. The ability to identify depressive signs must be provided by educational institutions. Due to body image issues, some students may develop non-clinical depression. This makes their depressive symptoms even harder to identify. Thus, they are more prone to eating disorders. The Body Project is an example of a successful body image intervention. Participants in this course critique the ideal weight using verbal, written, and behavioral exercises to foster positive perceptions of their own bodies. College counseling happens to be a major strategy to combat the increasing cases of diagnosable eating disorders. Students can benefit from supportive and problem-focused counseling. One-on-one sessions can be utilized to work closely with patients to identify the root of their problems. This helps patients to be better at communicating their problems instead of suppressing it and letting it fester from within.
Our site uses quantitative survey and article research to collect data. The site focused on students in UTP who were classified according to the gender, years of study in UTP, and course. An online survey was conducted by using Google Form to collect information on eating disorder. We used to compare analysis method. The answers to the objective questions from the online surveys were compared and analyzed accordingly. In order to interpret our data by bar graphing and pie charts, we used to visualize the different types of responses from all respondents.
Our survey that we conducted had an even number of male and female respondents. As for their year of study, it was found that most respondents were in their first year as shown in figure 4.1. Half the respondents were from the chemical engineering department. The results might be due to the survey being promoted largely in WhatsApp groups relevant to these demographics.
The subtopic of awareness of eating disorder among students, we can conclude that UTP students actually have a good awareness of eating disorder. For instance, when asked whether eating disorder should be considered as a mental health issue, such as in figure 3.1, 16 respondents either agree or strongly agree with the statement, whereas 10 respondents either disagree or strongly disagree. This means that most students in UTP have had prior exposure to the topic. On another hand, when asked if developing rigid rule around eating can be classified inherently as an eating disorder, the amount between those who agree and those who disagree were almost symmetrical. When the data was analyzed according to gender, such as in figure 4.4, it was found that more males chose to stay neutral on the statement, whereas more females had a stance on it. Chen et al. Proposed that females have more encounters with these scenarios, such as having strict diets and eating small portions to lose weight.
Firstly, 46.9% of respondents believe that unrealistic body standards in the media is the most prominent factor in causing eating disorders. Media plays a significant role in shaping our self-image, and constant exposure to idealized body types can lead us to internalize these standards as the norm. With that, we may find ourselves judging our own appearances against unreasonable expectations. After that, peer influence can further worsen this issue. For example, in university, students might find themselves surrounded by many of their peers who overly prioritize appearance and body image. To fit in, they may be compelled to emulate that and adopt similar behaviors. 18.8% of respondents stated that they frequently talk about diets and weight loss methods. Another 18.8% confess that they are secretive with their food choices to avoid criticism from others. This phenomenon also shows similar trends throughout both genders, meaning that both genders frequently compare their bodies due to influences in media and society.
37.5% of respondents identified academic stress and the transition to university life as a significant factor in causing eating disorders. The students may have homesickness, which results them in using food to cope. Students with newfound freedom in meal choices may develop abnormal eating patterns due to time management challenges. Hunger-driven consumption of junk food can cause obesity and later cause eating disorders. First-year students particularly tend to use eating as a coping mechanism and experience stress-related emotional eating. Data showed that chemical engineering students had a higher likelihood of poor scheduling affecting their eating patterns. This is possibly due to the demanding nature of this program, prioritizing academics and struggling with workload scheduling. However, it's worth noting that this data may be a bit skewed.
Gender also played a role in affecting eating disorder occurrence. Research made by Jean studied to validate that further support this opinion that 87.5% of women are more likely to experience eating disorder. So we can conclude that in society, all the women weight in body tap to a higher extent than men.
Low self-esteem is a symptom of multitude of mental disorders. When asked whether low self-esteem would lead students to base their self-worth on their body image, 34.4% of respondents strongly agreed. This means that if someone has low self-esteem, they place greater importance on their body image. However, both genders are unable to agree on this as shown in figure 4.11. Females lean more towards agreeing that low self-esteem leads to body dissatisfaction and eating disorders. However, males are more neutral on the subject. This aligns with other research that indicates females are harsher on their own body image, and it will easily nudge them towards eating disorders compared to males. We then asked what was the most common trauma-linked cause that leads to eating disorder. Half of the respondents answered pre-existing mental health conditions, while almost half of them answered contracting trauma from abuse during childhood. Only one respondent chose medical complications. We could derive that eating disorders are linked to psychological aspects rather than medical aspects. In other words, eating disorders depends mostly on one's environment and experience.
Firstly, majority of respondents agreed that having regular meal times, balanced nutrition, and sufficient sleep is the best way of prevention. Other than that, respondents also favor educating themselves through YouTube, books, and so on. Another method is to create supportive networks in which students can receive emotional support. Respondents agreed that they would always seek help if they ever suffered from this illness. This help can either be professional or in the form of support groups.
According to the survey, 37.5% of respondents agreed that UTP Counseling Center can offer confidential consultations, and students emphasize the importance of a secure and private environment where they can comfortably seek treatment for disordered eating. 34.4% of respondents suggest establishing regular medical checkups at a UTP clinic. These checkups allow for assessment to specialized therapy to ensure better care for patients.
In conclusion, the prevalence of eating disorders in our society demands our collective attention. Our findings indicate that the most significant factor contributing to eating disorders among university students is the portrayal of unrealistic body standards in the media. Nowadays, the media often presents idealized body types, leading many individuals to internalize these high standards as normal, resulting in unrealistic expectations of themselves. On the other hand, we have identified the best possible solutions, which are having appropriate sleep, having adequate diets, and having regular mealtimes. By promoting a body-positive society, we can create a world where individuals embrace self-acceptance and healthy living, while simultaneously eradicating eating disorders.
We found that our study has certain limitations due to the limited depth and lack of context provided by our online questionnaires. It's possible that the use of preset response options have limited our ability to fully grasp and understand the intricate details of this subject. Meanwhile, the use of self-reported data in our online survey also poses as another issue.
Without qualitative data and in-depth background information, our understanding of the subject may be limited. This restriction made it difficult for us to fully grasp disordered victims' personal points of view.
Meanwhile, the use of self-reported data in our online survey also poses as another issue.
The data we obtained is reliant on respondents' memory and ability to correctly comprehend the survey questions. However, because self-reported data is prone to memory biases and misunderstanding, our study may contain minor errors and inconsistencies.
For recommendation for future research, there are many suggestions that can be made to overcome the limitation mentioned above. First, combine qualitative research technique with online questionnaire. You can use real-time interaction during face-to-face or virtual interviews conducted via video calls that enables us to delve deeper into the viewpoints, feelings, and personal experiences of the participant. Participants can express their experience, viewpoints, and difficulties with eating disorder using open-ended replies and follow-up questions. We can also get a better grasp of the subject by integrating qualitative and quantitative data. To overcome the constraint of self-reported data, we can use cross-verification that can be gained by multiple sources. Self-reported data may be verified with the use of triangulation, which includes cross-verifying data from many sources. In addition to self-reports, researchers may also use medical records or observations to get objective data.